We've recognised for a number of years now that asthma and COPD are really terms that encompass a number of different underlying conditions. And that presents us with a challenge, because when we see patients with those conditions, we're not quite sure how to best treat them. So actually understanding how all of these different components of the disease represent themselves in an individual patient, and understanding that means we can then make better decisions in terms of their treatment. So AirPROM is really trying to understand how we then get better use of all the information we can gain in a clinic and try and integrate all of that information into be able to help us with decisions when we're seeing our patients. And it's also there to try and help with decisions in development of clinical trials. So how can we go much further and actually be able to say for an individual patient, what is the right treatment choice for you? What's going to happen when you have that therapy? And I think that's something that stakeholders are clearly going to be interested in from policymakers, but perhaps far more important is actually that's what patients need. So the AirPROM project is really at a stage where it's using a number of approaches which are going to initially be most informative in a clinical trial setting, and this is because of the complexity of the analysis. What we would hope is that complexity becomes more routine, that it's something that then will have a place actually in the doctor's clinic. This is a real opportunity for patients to really champion the fact that their disease is just their disease. And the patient can then actually then use that to then voice and use their voice as a group to policymakers, to healthcare providers, to those that develop drugs, and say that it's actually now that we expect and demand that we actually need to be able to understand why, as an individual, I should have this treatment and what's the likely outcome. And I think actually giving that voice and that power back to the patients by actually providing them with the information is going to be really the great legacy.